Welcome to the American Red Cross's Respiratory Protection Training for COVID-19. Our Respiratory Protection Program complies with OSHA 29 CFR 1910.134, the Respiratory Protection Standard. The purpose of this Respiratory Protection Program is to establish procedures to ensure that all American Red Cross employees from respiratory hazards through proper selection and use of respirators. The Respiratory Protection Program can be found on Safety's Exchange page under the General Safety Topic Hub, or you can follow the link below. Before beginning to discuss respirators, I want to talk a little bit about prevention. It's important to recognize that the optimal way to prevent airborne transmission is to use a combination of interventions from across the hierarchy of controls, not just PPE alone. The best way to prevent illness is to avoid being exposed to the virus. However, as a reminder, the CDC always recommends everyday preventative actions, such as hand washing, to prevent the spread of respiratory diseases. The American Red Cross will identify and evaluate the respiratory hazard or hazards in the workplace. This evaluation shall include a reasonable estimate of employee exposures to respiratory hazards and an identification of the contaminant's chemical state as well as the physical form. For this respiratory protection training, we are going to be focusing solely on the N95 respirator. An N95 respirator is a respiratory protective device designed to achieve a very close facial fit and very effective filtration of airborne particles. The N95 designation means that when subjected to careful testing, the respirator blocks at least 95% of very small test particles. If properly fitted, the filtration capabilities of an N95 respirator exceed those of face masks.
Wear a respirator to protect yourself against airborne contaminants in your workplace. It is very important to follow proper procedures for putting it on and taking it off. The process of putting on and taking off your respirator is also referred to as donning and doffing. Respirator manufacturers supply instructions on how to properly don and doff, put on and take off each respirator they produce. The manufacturer also supplies instructions on how to properly conduct a user seal check. A user seal check is a way to verify that the respirator has been properly positioned on your face to assure a proper seal. A user seal check must be performed each time you put on a respirator to check that it has been donned correctly. Remember, always follow the respirator manufacturer's instructions for the specific respirator model that you are using. Here are some general instructions for properly donning and doffing and properly conducting a user seal check for the two most common types of respirators. Let's begin with general instructions for a disposable filtering facepiece respirator, which is often referred to as an N95 or a dust mask. Inspect the respirator, including the straps, for tears or damage. If you find any damage to the respirator, replace it. If your respirator comes out of its original container folded flat, open the folds fully, following the manufacturer's instructions. Using one hand, place the respirator on your face with the nose piece at your fingertips, allowing the headbands to hang freely. The nose piece should span and cover the bridge of your nose, and the respirator should cup your chin. Pull the top strap over your head, resting it high at the back of your head. Pull the bottom strap over your head and position it around your neck and below your ears. Be sure not to crisscross the straps. Make sure that your mouth and nose are covered by the respirator. If the nose piece has a metal nose piece or strip, use both hands to mold the nose strip to conform to the shape of your nose by pushing inward while moving your fingertips down along both sides of the nose piece. Next, conduct a user seal check. It's essential to follow the manufacturer's user seal check instructions because the manufacturer knows the best method for checking their respirator. Generally speaking, the manufacturer's instructions are based on covering the surface of the respirator, usually with your hands, so that air is prevented from passing through the filtering facepiece. A positive pressure seal check is performed by gently exhaling to see if the facepiece bulges slightly. For a negative pressure seal check, take a quick deep breath to see if the facepiece collapses slightly. During either test, if air leaks out between your face and the respirator's face seal, the respirator may not fit your face properly. One way that you can identify leakage is if you feel air blowing through the seal onto your face or eyes. If you feel leakage, readjust the fit of your respirator and check the seal again. If you cannot achieve a proper seal, you are not protected and should not enter a hazardous area. See your supervisor to determine what the problem may be. When you're finished wearing the respirator, carefully remove it without touching the exterior, because the exterior may be contaminated. Discard your respirator according to your company's procedures.
One consideration when wearing an N95 respirator is whether or not you have facial hair. Facial hair that lies along the ceiling area of a respirator, beards, sideburns, mustaches, or even stubble, should not be permitted on employees who are required to wear respirators that rely on tight face piece fit. The notice warns that facial hair growing in or protruding into the area of the good primary sealing surfaces of a respirator will prevent a good seal. The following chart from the CDC will illustrate which facial hairstyles will and will not work with an N95 respirator. Now we will discuss extended use or reuse of N95 respirators. Supplies of N95 respirators can become depleted during an influenza pandemic or widespread outbreaks of other infectious respiratory illnesses. Existing CDC guidance recommends that a combination of approaches to conserve supplies while safeguarding healthcare workers in such circumstances, such as extended use and reuse of N95 respirators. The guidance below will help to limit potential N95 respirator surface contamination. Use a clean face shield over an N95 respirator. Hang used respirators in a designated storage area or keep them in a clean, breathable container, such as a paper bag between uses. To minimize potential cross-contamination, store respirators so that they do not touch each other and the person using the respirator is clearly identified. Clean hands with soap and water or an alcohol-based hand sanitizer before and after touching or adjusting the respirator. Avoid touching the inside of the respirator. If inadvertent contact is made with the inside of the respirator, perform hand hygiene as described above. Use a pair of clean gloves when donning a used N95 respirator and performing a user seal check. Discard the gloves after the N95 respirator is donned and any adjustments are made to ensure the respirator is sitting comfortably on your face with a good seal. Discard any respirator that is obviously damaged, contaminated, or becomes hard to breathe through. For more detailed information, you can follow the link below to see the CDC guidance. If you have a pre-existing medical condition, wearing a mask may make breathing more difficult because you must pull air through the mask as you inhale. People with known or suspected breathing problems, emphysema, chronic obstructive pulmonary disease, or COPD, asthma, or cardiopulmonary problems should consult their physician before using one. If at any time during the use of the mask you experience a headache, nausea, dizziness, or have difficulty breathing, immediately leave the area. Remove the mask, get fresh air, and seek medical attention if needed. You have now completed the respiratory protection training program for COVID-19. Your health and safety are of utmost concern, so before you begin using your N95 respirator, you must complete a brief medical screening questionnaire. To complete the questionnaire, indicate you have completed this training video and then continue on to answer the questions that follow. In the event that you need to access the questionnaire in the future, there is a link and a code below. Follow the link or scan the code to complete by computer, tablet, or mobile device.